Hope everyone is doing well today. My name is Dr. Josh Schaefer. I'm a periodontist here in Los Angeles. You may also know me as Implants90210 on Instagram. So if you've yet to check out my profile, feel free to take a look and give me a follow. Today we're going to be going over the membrane fixation kit by Osteogenics. So taking a look over here, we can see it comes in a very nice blue and white box, the Profix kit. And in order to open it up, let me just get a better view for you guys right here. Hopefully you guys can all see that. Opening it up, we can see that we have a couple of components in here. We have the driver handle right here. We have the dial. This dial is where we house the membrane fixation screws. You can also keep your tenting screws and your bone fixation screws here in as well. Moving along, we have both blades that we attach to the driver handle. We have the long blade, 76 millimeters, and we have the short blade, which is 56. The long blade is used for the anterior cases, and the short blade is used for posterior cases where access is quite limited. Before we get started, it's really important to know that this kit does not come sterile. So if you want to use it for patient use, make sure to autoclave it and sterilize it before getting started. So let's go a little bit more into detail about the driver handle. So the driver handle has a black portion and a silver portion. The silver portion over here, as you can see, can be moved back and forth. So back and forth and back and forth. In order to place the blade inside the driver handle, we have to get the silver portion, pull it back, and then we'll hear a click, and the blade will be in place. There is some wiggle room here between the handle and the blade, but that's completely normal, and there's nothing wrong with your kit. If we want to release the blade, do the same thing, lift out and take the blade out, okay? So in order to grab the screw, we have to go to completely parallel to that screw, 180 degrees. And this is the main thing that we need to know before we get started in picking up the screw. In order to rotate this driver handle, instead of using it and rotating it from the back, what we have to do is we have to rotate the black portion, okay? So what we do is we get the ball of the handle, put in the palm of our hand, and using our thumb and our index finger, we rotate this black portion in a clockwise direction to end up fully seating the screw. Once we know that, like I said before, we can grab the screw, once again, back of the driver handle to the palm of the hand, and then using our thumb and our index finger, we can rotate. Once we rotate, we can see here that we have the screw fully seated with the driver handle. So we get our dentiform. Okay, we get our dentiform right here, and at a completely 90 degree angle to the ridge, we go in here and using that in a clockwise fashion, putting the screw all the way in. Now if you want to disengage when you're fully seated, instead of going straight out, rotate the handle to a 45 degree angle and let go, and the screw will stay in place, okay? So one other thing I want to tell you guys before we end today, it is absolutely necessary to purchase something called the 1.2 millimeter latch type handle, the blade. So this blade doesn't come with your kit. It has to be purchased separately from the kit for $65 from Osteogenics, but it's absolutely crucial that you buy it because you can put this in your implant motor handpiece and it helps you place screws on the lingual or the palatal portion of your ridge or your GBR. So hopefully that was helpful for you guys. I appreciate you guys watching, and be well in these troubling times. Thank you so much.